Well, thank you for coming. Thank you for
Pleasure.
making the time. And you probably do know what the purpose of this commission is.
I do. I've read the documents, and if they're reflective of the purpose, then
Absolutely.
yes.
And thank you. And I think you know all panel members here.
I do.
I've introduced them to you earlier. And we're very excited in what you're doing.
Well, thank you.
And we'd love to hear more about that and how would that, enhance London's profile and make it more attractive in this health and wealth agenda that we're trying to drive through this commission.
Sure. Well, I come at this, I guess, through three different perspectives. First and foremost, I'm chief exec of a UK-based biotech company, so using the academic and other services that are available across the UK with particular emphasis in the southeast. I also have a long history in big pharmaceutical companies, and in particular, I spent 5 years at an American company called Pfizer, running development outside of the US. So I've got a reasonable experience, including establishing organizations in what we may consider competitive environments such as China, Singapore, and India. And latterly, I've been helping the Mayor's office by acting as an interim chair for a small working group who are looking at emphasizing our abilities to grow the economy in London through the life sciences and medical research that is conducted here, and that is called MedCity, and it's something that maybe this panel have heard of previously, but I'd be delighted to outline those activities of MedCity if that would be of benefit.
Yeah, it'd be great. Yeah.
So MedCity was established by the Mayor's office to help understand what the gaps might be in delivering enhanced economic growth in London and then ultimately in the greater southeast. Between all of the research activities that go on in life sciences, access to patients through NHS in the London area, and of course greater connections with Oxford and Cambridge to form this greater southeast cluster, which I heard in a previous discussion being referenced. And certainly I worked for 3 years in Boston, which I think is an area we ought to talk about with respect to competition. And it really does look like the southeast. It doesn't look like the King's Road in London. And indeed, to some, it looks even greater than that in the UK as a whole, but with a real emphasis in London and the southeast. So MedCity was established, as I said, to try and understand what the features might be of London that would help with enhanced economic growth. And in essence, it fell, as we found it to this point, into four categories. The first is that there is an assumption that London's institutes, so the higher education institutes, the NHS, AHSCs, AHSNs, are they okay to use? I'm just thinking,
yes,
okay,
yes,
so
yes,
we can use,
yeah,
we can use
Yep.
TLAs
Yep.
throughout, okay.
Yep.
And assuming that they would work together as one for the greater good, as well as, of course, continuing on their individual missions, which are important. To that mix, we've added the Welcome, the CRIC, which of course will be a real pivot point and catalyst for London internationally in the future. And of course, beyond, through the AHSNs, beyond just the understood boundaries of London and reaching out into the home counties through the hospital trust networks and so on, all of which I'm sure you're familiar with. So the gaps are actually quite simple and obvious from our perspective, but relatively sophisticated to solve for. So the first is giving all of those institutions collectively a common voice and a common identity that can be identified to its customers. And I use customers in the setting here that they are those who wish to conduct activities in London that would enhance its economic growth and throughput. So that could be creating jobs, building new buildings, inward investment, and so on and so forth. And so there is a gap. And if you, and we have talked to potential customers, whether they be pharmaceutical, other academic institutes, or even to some extent those who are grant-giving bodies, it's difficult to understand for London what the image or what London is with respect to its life sciences community. Many people have many individual connections with individual academics, individual heads of departments, but certainly not collectively. And indeed, most people will describe successful relationships with those individuals. So one example might be a clinical trialist who can talk to you at length about the multiple clinical trials he or she has done with a particular company. But that misses the point that there are many other potential clinical trialists and, importantly, many other patients who could be on clinical trials who are simply missing from those relationships. And so there's an example where we need to extend that through this communication, through this single identity. The other gap that we found was the absence of a real understanding of what the customer is looking for. And again, it's not saying that there are not individual examples where that's on the leading edge, but collectively and for the majority, that understanding of the customer is missing. And it can, if we stay with the theme of clinical trialing, just by the way of a worked example, it can be as simple as not understanding that if a customer asks for 10 patients, then they want 10 evaluable patients. And it's understanding the nuance around that word evaluable, so the data is clean, the data retractable, and so on. That makes the difference. And it's really at that sort of level that understanding needs to be, in one instance. Much broader than that, of course, you can say it's understanding that customers want to be able to access an integrated healthcare system to know not just how to deliver medicines, but how to deliver software to that patient and how that patient will interact with the medicine through that software, and so on and so forth. So very small and narrow up to much broader and far-reaching. The third area is then being able to describe clearly what the London offer is. And again, there are individual instances of real success that I think even members of the public would be able, who are not familiar with life sciences research, would be able to describe as being successful. They're often well advertised, but of course they're often quite narrow and related to individual departments and individual academics or researchers. What we need to be able to do is articulate in the face of understanding what the customer is after, what the offer actually is, and we hopefully will marry those two together and then create a transaction which will allow economic benefit. And so that's really the element. And then finally, and probably the most difficult of the four, is to establish a culture of true entrepreneurism. And that requires a couple of elements. One is that we help bridge what we've termed the entrepreneurial gap, and that is, briefly, those individuals from wherever they come, whether they be private or institutional, to understand how it is to take an idea forward towards the market. And again, there are lots and lots of very good examples in individual institutions where this has occurred, but also to help that be financed. And one of the real big differences between London and perhaps the southwest of the US, the Bay Area around San Francisco, where I spent the whole of last week, or in Boston, is the level of financing that's available locally to local businesses. And I think that's in terms of the fourth element, that's the critical piece. So marrying together entrepreneurs who are able to intellectualize how to bridge that entrepreneurial gap and have them understand that it's not something which they're born with, and it's also something which is perfectly achievable by normally educated people, and then bringing finance to bear locally on that. And so I guess they are the four elements that we've looked at. And then to answer the proposition in the beginning, so MedCity has really been established to try to catalyze each of those elements being driven forward, but operating not through a new institution or a new bureaucracy, but simply as as I said, catalyst that will help those institutions collectively across London work together to address those issues that we've identified through the process.
Well, that's fantastic. I was aware of some of it, but I wasn't certainly not on the 4 points that you've alluded to. How are you getting on with the first one? Is the landscape it's quite rich, no question about that. Is it too complicated? Do you think that they work together? You have to remember, I mean, you know this more than I do, these are highly competitive organizations, and they compete with each other.
Yes.
Certainly the universities do, and then to a lesser degree the AHSCs. So what incentives have you, I mean, have you found, is there anything we can help you with in making them sing and dance together?
Yeah, so the evidence I have at my fingertips suggests that there is a real willingness to work together, a real willingness to operate around this single cause of generating increased economic impact from what we're doing. I think we need also to, as part of that, celebrate individual success as well and allow that competition to continue behind the scenes. And frankly, one of the things we found is that we rather hide our light under our bushel here in London. There are many, many things which are world leading, which no one talks about, the individuals nor the institutions, and I think we need to get better at that. And part of the MedCity campaign will be to highlight those things. But certainly through the auspices of the HSC heads and the HSN heads in London, I have found nothing but support for collaboration.
Good.
And other major institutions, the leaders of those institutions that I've already mentioned, are similarly motivated at the moment. I think our challenge is to make sure that we continue with that momentum and don't allow small distractions to get in our way of this ambition. The ambition really, I think, will be hindered by the time scale we're operating on. So clearly we have very short-term months, we have single-year ambitions. The whole campaign is a 7-year one, but ultimately the goal is a 30-year ambition. And the reason we say that is that if you go to Boston, Cambridge, Boston, I used to have an office on a thing called Kendall Square, and Kendall Square is famously the place where all biotech began. At least that's the story. And I think that's fine. And if we say, okay, well, let's ape that, then what we need to do is recognize the timescale. So the first biotech company was started in 1964 in Cambridge, Massachusetts. So that's 50 years ago. They stumbled along the way, and then they opened in areas that were crime-ridden and needed full development. We have institutions already that exist, and so don't need to be founded. So there are certainly ways of foreshortening that process. But I think we start to collaborate today, and we need to continue that forcefully and together for many years ahead, and we need to institutionalize that as well.
I need to move on, but just one very quickly though. I know we keep talking about London, but have you thought of adding, with, you know, Oxford and Cambridge are not far away, and most of these organisations in London work very closely with Oxford and Cambridge, and I know the mayor hasn't yet expanded to Oxford and Cambridgeshire. I just wanted to see what your thoughts are in having Oxford and Cambridge part of the MedCity discussions.
Well, so actively as part of our advisory group, we've added members of Oxford and Cambridge. I don't think we need to be careful to get our act together in London first and foremost.
Good point.
And I think that's important.
Absolutely.
I know from conversations that Cambridge and Oxford, if one can describe huge institutions like that as individuals, but they're enthusiastic to support this process. But we need to be conscious that we've got to get our act together first and foremost.
Good point. Thank you. Peter, and then I'll move.
Okay, thank you. Fascinating, Eliot. I mean, with your broad experience, I wanted to come back to your point about a common identity, because as Zara introduced there, Cambridge, Oxford, London, you know, 3 in their own right, cities with great global brands, but meaning something very different. How important is it, do you think, to have that common identity? And if so, any thoughts on how we could bring that about?
Sure. Well, certainly the research that was conducted on behalf of MedCity suggested that one of the gaps was there wasn't a front door to customers to get into if they didn't know the way into London through an individual relationship. And so really part of the effort around a common identity is to allow that front door. We hope with the small group that are involved with MedCity, there will be sufficient connectivity, and that's part of the purpose of MedCity, to be able to then direct to the institutes that may actually be a much more appropriate contact, and that would work in parallel with individual institutional connections already. And it's through the latter that the brands of Oxford, Cambridge, Imperial, Crick will continue to thrive and actually be enhanced, we hope, by MedCity. So I've been trying to come up with a kind of joiner metaphor, but I've been failing miserably. So it's a sort of veneer or a glue. I keep ending up back at catalyst. There really isn't any necessity to break anything which exists. It's really a case of joining things up, and we think this brand will help join those things up. The challenge is getting a brand that someone else already hasn't got, and that is it's a detail, but that's the process that we're going. I think MedCity will probably stick.
Thank you.
Thank you. Chris?
So I like the idea this is building something that will last for years, 30 years, it's great, but life is in kind of cycles, isn't it, of cycles of impatience. So do you have some tactics about how you might get some early successes which might build confidence and allow you to do some of the more difficult and sustainable stuff later?
Yeah, sure. So I think, and some of this speaks to Lord Darzi's question earlier about the historically competing institutions. Yeah. So what we are doing is through an advisory group and through a management board of MedCity, joining up these institutions so that the working together becomes common practice, so that people can see how easy it is, but also how difficult it can be as well. And so really, in a sense, having those cross-institutional conversations is a very, very early win. And I would argue that that's already past in the MedCity triumph, because we have the HSNs, AHSCs and other institutions joining together in this common cause. Then really early wins, I think we need to pick a couple of areas where there is clearly a need from a customer base that we can excel at. And I give you, and I come back to clinical trials, but I give you clinical trials as an example, not necessarily suggesting that this will be the first one that we go out with, but we are looking at it. We have 8 million patients in London, an enormous pool of diversity of disease, diversity of population, and that's barely tapped from a sponsored clinical research perspective. Lots and lots of important trials go on within the NHS structure, within the academic structures. But in terms of sponsored trials, it's limited. And I believe that that's an area that we could get a very early win, just simply by joining up more than 1 or 2 individual investigators and joining up more than that. I think that's one area. The other speaks to the entrepreneurism. Again, if we go back to Boston, Cambridge, or even California, you see that many of the organizations that are started up, biotechs and others, tend to have multiple institutions as their founders. Here we commonly have 1 or 2 institutions or 1 or 2 departments. The company I started in Boston in 2006 had 6 institutions, 1 from the West Coast and 5 from the Boston-Cambridge area, all working together, all able to share IP, all working under common secrecy agreements. That is a simple concept and ought to be relatively simple to join together once individuals are helped to know that their idea could marry nicely with someone else's idea. And that's an information flow challenge that we face, but one that I think we can tackle relatively quickly. So there would be 2 examples of areas that we would pick off in order to begin to move the process forward.
David?
Can I just follow up with a couple of questions on trajectory and metrics? I asked the previous person if they had a feel for the current trajectory, because what you want to know is, are we making a difference? Yeah. So it's, do you feel the baseline is flat, or over the last 2 or 3 years has been improving or getting worse in terms of the sort of things you've talked about within London? So I want to get a feel for the current trajectory. And then you rightly said this is a long game, 30 years, so you have to have some metrics you can track. And although I mean, you can measure whether you've got one front door or not.
Yes.
The thing that matters is what's behind the front door, because if you open the front door and it's not a pleasant sight, this sends the customer away.
Absolutely.
So you talked about the culture of entrepreneurship. I think that's tremendously important. How will we know, what can we do to measure it that will give us earlier warning that we're getting better, rather than waiting 7 years?
Sure. So to pick off the first, there isn't a simple answer to your first question, David, because it depends on what one is looking at. So if you look at the trajectory of translational research, then I would suggest that has been improving and continues to improve for London specifically. I think there are probably regional variations here. If you look at larger clinical trialing, just to stay in that field, then that is probably flat, if not a little down. So these are the big phase 3 trials, multi-centre, where one would have several centres, perhaps in London. If you look at investment in the investment community into biotech and biomedical research, then that is either flat or down. Some of that, of course, imposed by the economic circumstances we found, but some of it to do with the nature of the individuals available who are willing to take on the risk of running biotech organizations, which can often survive or fail according to their next set of data. And that's really where we bridge into this entrepreneurial culture. And our view is that we need to start right at the beginning. The professors, readers, senior lecturers, and even to some extent the postdocs of today will not be the majority of the entrepreneurs of tomorrow. Much more likely are the late undergrads, the immediate postdocs and the doctoral students, as well as intercalating medics and newly qualified medics, and all those at that sort of age and that sort of stage in their career.
So can I just ask a follow-on on that? Yeah. Because I'm really concerned about the top 1 to 2% talent that drives so much. And exactly as you say, at the younger end of the spectrum. So what could we do collectively that made it more appealing for that top talent at the very young end, as end trainee talent, to come here rather than, these are global people. They can move nationally, they can move globally. What could we do collectively rather than individually to enhance our pull?
Yeah, so there are things which are directly related to my area of expertise, which are funding, to make sure that there is sustained funding. So if your first biotech fails, then you can move quickly to the next one, so you don't have to sell the house or the dog. And that's part of that fourth mission. So build this entrepreneurship, build a platform of financing. We don't have, sitting here today, answers to where that financing comes from or how it's incentivized, though that is a process which is ongoing.
So more tolerance of early failure, not to put you off.
Absolutely. And with that, those financiers who will be willing to tolerate that failure. I would say in biotech, having worked on both sides of the pond, that is one of the major differences, is that failure of a technology, and I'm being specific, failure of a technology doesn't necessarily mean failure of a career. In the US, it's more correlated. It's not absolute, but it's more correlated here. So it's more difficult for a failed entrepreneur to go on and get refunded for the next one, which frankly is crazy in my view, because that experience is second to none for that individual moving through. So I think there's a cultural component. Again, it's back down to financing. It's to do with the level of financing available. Other elements are not within my scope, but most entrepreneurs are not highly paid, and so they need somewhere to live. So transport, housing, they have children, so schools. Those scientists are often not monolithically scientific, and so need to have entertainment and feel that they have a fulfilled life. And if you talk to folks in the Bay Area, if you talk to people in Boston, although housing in both of those areas is very expensive, often the entrepreneurs will be there because of their perceived quality of life. And I think we need to get the message out about what a great quality of life you can have here in London as well. Often the perception is far away from reality. Now, this is not my area of expertise, but we have to be conscious that we need to attract this top 1 to 2%, as you described, David.
So could I ask you if you'd be prepared to send us something on your key point about that difference on the entrepreneurship, on the failure, because we've quite a culture that failure being poorly tolerated either in healthcare or universities.
Yes.
And if you perceive that as a fundamental difference, how we might address that using collective resources. Because I understand very much your point. You should almost reward the early failure because you learn so much from it.
Yeah.
I have no sense that that's buried in our culture at the moment, either in healthcare or universities. So I'd be very grateful if you could send us some evidence on that. That would
Sure,
be most
I'd be happy to. Yeah, absolutely.
Well, you're doing an amazing job, to be honest. I think you've done the whole theme. Peter is smiling, yeah. And,
that's very kind of you.
These 4 gaps are vitally important.
Yes.
And I think you've raised the entrepreneurial gap, definitely. And I think all of that is environment. I don't think the genetic pool of entrepreneurship is different in this country than it is in Boston or San Francisco. Definitely not. It's the environment. I think you raised one of the issues about the environment. No one actually gets funded in the US if they haven't failed once. Failure in the US is experience. Failure here is a failure. And so I think that's important. And I think if you really specifically look at the medical graduates, most of the entrepreneurs are usually in medical school and take a couple of years out to go and do an entrepreneurial startup, as you know, in the US. We have 0% of that in this country because that's an odd thing to do. You will not progress your career if you've left for a couple of years, whether that's an undergraduate or even an immediately postgraduate. So, again, you're doing it all. So if you wouldn't mind just thinking loud here about what could we do, I suspect we can influence the first gap, which is the structural gap. We can influence behavioral change there, without a question, if that is needed. I think you've certainly dealt with the who's going to open the door, and probably better off being open through MedCity rather than the London offer. Again, we can help. I think the Commission could influence what the London offer should be, and we can't do much about venture capital, but I suspect you're probably in a better place to influence that, because that's another dry land at the moment, although in the US is building up. So anything you can think of, please drop us a line.
Sure,
and Peter is leading on this, and we're very keen on this. We're keen to support you in anything you're doing.
Yeah,
Well,
I'm more than happy to follow up, Eliot, separately.
Yeah, well, I'm likewise, Peter. So I guess we can exchange through the Secretariat details and so on. I guess one other point, just while if I might.
Yeah, please. Yeah.
One of the things that becomes important, and this is a longer term vision, which I didn't mention because David was searching for something near term, which is exactly right. One of the things one observes in Europe, if you look at the macro outcome of biotech, is that a successful biotech tends to get bought by something much larger.
Sure.
And that's a perception. So success equals your bought return of capital to investors, and hopefully a multiple of that capital. In the US, that is still the case, but it's also the case that biotechs emerge. So Amgen in 1990 was smaller than my company is today, now one of the top 10 pharmaceutical companies on the planet. Within 10 years, Amgen turned from being a supplier of ideas and people and IP to a buyer of ideas and people and IP, and of course helps then foster a new biotech who will come and use Amgen as a customer. The same success criteria are fewer and further between. There are one or two examples now in the UK and across Europe where smaller biotechs are growing up, but not to the same extent and certainly not to the same size. I don't know what the solution is to this, and I think it comes perhaps to the tolerance of risk and the risk profile of the financing and the nature of organisations who finance biotech and other medical research organisations. But that's an important feature in the environment as well. And that's not just true of London, Oxford and Cambridge, it's also true of the UK as a whole. And that's something that we also need to be cognizant of as we move forward with this, and in particular as we begin to talk about the nature of capital that may become available to invest in this whole community. Yeah. And if I might give one shining example of this, the Wellcome have established a new fund, and it's long-term funding. It's not 3 or 5 years in and out. It's we want to build organisations. Yeah. And frankly, if that can be a seed and a model for others, then that would be super.
Yeah, wonderful. Well, thank you very, very much. Thank you for sparing the time.
Okay,
Your busy schedule, and good luck in both your jobs.
Yes, thank you.
Thank you. Thank you.